This is AP Med. My name is Andrew Poveda, and today I am interviewing Michael Lesgart. He's a medical student at Temple, and he is also the co-director for LMSA Northeast. Now, do you want to tell us about yourself, Michael?
Yeah, thank you so much for having me, Andrew. Big fan of your initiative here at the AP Med podcast and in partnering with the LMSA Northeast. So I grew up in Los Angeles to an Argentine family. Both my parents immigrated from Rosario, Argentina, and really all the way up until med school. Spent my upbringing in California. Went to undergrad at UCLA and graduated in 2020 with a degree in psychobiology. After that, I took a gap year in between undergrad and med school, working at the West Los Angeles VA in a research lab focusing on mental illnesses with veterans. And that's really where I developed some of my interest in clinical research. Then moved to Philadelphia, all the way over to the East Coast for medical school at Temple in the North Philadelphia campus. And it's been an incredible experience, working with our patient population and really getting a lot of great clinical skills and practice in during my medical training. And now I recently matched urology residency at Temple. Delighted to stay on for the next 5 years of my surgical training. And I really fall in love with the East Coast. Of course, we'd be remiss without mentioning LMSA Northeast. I got involved with LMSA beginning of my med school, as a first year, and it's been an incredible experience getting to work with the boards and really driving our mission towards increasing Latino representation in medicine. And that's really taught me a lot about leadership, about working within a team, about handling, challenges that come your way. And I'm just really grateful to be leaving the board in excellent hands as I wrap up my med school in a couple months here.
Yeah, great. Congratulations on matching as well.
Thank you,
At
thank
Temple
you.
too. Yeah, that's great. Do you want to tell us a little bit about who you are outside of medicine? I know you, yeah, do you want to tell us about like your hobbies and things of that sort?
Yeah, outside of medicine, I really enjoy spending time with my wife. We're fortunate to have done grad school in the Philadelphia area together, and really starting our careers off in the Northeast has been a priority of ours. We love to travel, we love to cook together. I have a food Instagram, Med Student Cooks,
That's all that.
and making homemade pasta, grilling, really bringing friends and family around the dinner table is something special that I always cherish with anytime I get off of school duties or clinical duties. And I like to stay active as well. Snowboarding. I grew up going to Big Bear, to Lake Tahoe, and I'm trying to delve into some skiing here in the East Coast as well. So that's who I am outside of med school and residency and all of that.
Yeah, snowboarding and skiing is great. Like I want to get into skiing myself, but obviously it's the end of the season, so you can't. It's kind of late now.
Yeah,
Um,
it's something you definitely got to plan for. You gotta see when you're gonna get some good snowfall and plan accordingly. So.
all the equipment as well you have to buy, or else you have to rent, and it's a lot of planning. Yeah, yeah.
Yeah, yeah, for sure, for sure.
Okay, so you said you cook a lot. You have a food Instagram page. What is your favorite cultural dish or dish in general? Both.
Yeah, that's a good question. There's so many. I think back to my favorite cultural dish. There's a lot of Italian influence in Argentine cuisine. And
Mhm.
growing up, my mom would make ossobuco, which is like a Italian stew, basically of it's part of like the leg of the cow. These big, round cuts of meat with a bone in the center. And I think just the way that she used to do it around special events really made an impression on me. And then now I'm carrying that, during Thanksgiving or New Year's or Christmas. So I would say ossobuco is my favorite. Also, homemade empanadas can't
Oh,
go wrong. I
yeah.
mean, it's very difficult, especially like I've made the dough from scratch before and
Oh, that's
and the beef filling and everything, and they come out really good. But it's a lot of work and very tedious, but it's definitely worth it. Um, and cuisine in general. No, probably like Italian food, Middle Eastern food, Argentine food. Like, I think Philadelphia is one of those cities that I was pleasantly surprised with the cuisine here moving from Los Angeles. And I feel like there's just so many great restaurants and bakeries and coffee shops that it's almost too many to explore. So um, that's definitely been a highlight of living here.
And would you say Philly has the best cheesecakes? And if so, like which is your go-to spot?
Yeah, so Philly cheesesteaks, it's a topic. It shouldn't be a topic of debate, but it definitely is. I'd have to give it to Angelo's in South Philly on Ninth Street. Be
Okay.
prepared for the wait. It's cash only. You got to wait like almost 2 hours. Last time I was there, but hands down, I think it's the best cheesesteak in the city. Um, Maybe honorable mention to like D'Alessandro's, but I think it's a far second.
Okay. I've never actually been to Philly, so I wouldn't know.
Should.
I've just had the cheesesteaks from Jersey. They're pretty good too, so I can't complain.
Yeah, yeah. No, come
Yeah.
down. We'll go together. I'll show you around. I'll show
Okay.
you around.
So transitioning into more of your like clinical and like as a student, I wanted to touch upon you getting into medicine. Was there ever a exact moment or opportunity or some type of event that made you want to pursue medicine? Was it something you've wanted since you were a child, or what happened like that?
Yeah, I wrote about this in my med school personal statement, but it was a distinct moment when I was really little, like 5 years old.
Mhm.
We were at a Rite Aid at a car trip, road trip stop at a random Rite Aid, and I went down to sit on this plastic chair, and it slipped from under me. I was wearing glasses, and the glasses kind of punctured my eye. And of course, you're a little kid, mom's gonna be you know, hysterical, but I was pretty fine. It was just like a little laceration and went to the emergency room and they had done just a few stitches on above my eye. And from then on, I thought they had done brain surgery on me, funny enough, as a
Okay.
little kid. And ever since then, I said I wanted to be a brain surgeon in school. And, my parents were very, very supportive of me wanting to look into medicine and pursue medicine, fortunately. And, I started volunteering in the emergency department at my local hospital. And really, I think what drew me in and what confirmed it were those patient interactions and kind of the emotional side of taking care of sick patients. And, even as a high school student, you're not really tasked with much, but even being able to bring them a blanket or a stuffed animal for a pediatric patient, and just making their time in the hospital incrementally better, I think is what initially drew me in to want to seriously pursue medicine in college, and then obviously like as you gain more clinical exposure, you confirm that this is what you want out of your career. And that led to me getting my EMT license and my phlebotomy license and getting more direct patient care in those settings, in outpatient settings, and during my EMT training as well. So I think that my path to medicine, came from kind of a, a funny place, this event that happened to me, but over time you find moments that really stand out to you, and it's something that you definitely want to be certain of because it's a long career path. It's challenging at times, certainly challenging. It's a financial investment, and it's a path that is incredibly rewarding in the end, but it takes a lot to get there. And now, kind of looking back on my medical school and my undergraduate, it's been all worth it in the end. But I think having that why, that dedication to your future patients, to for the benefit of their care in the future, is something that will keep you motivated because there are times that you're going to want to quit or step back. But I think being committed to your purpose and your goals is of the utmost importance.
Got it. Yeah. So we'll talk about how you were saying I want to be a brain surgeon, I want to be a brain surgeon, I want to be a brain surgeon, and then how you ended up picking urology, how you ended up applying for urology after. But I want to touch upon earlier on when you said that you said that you were a phlebotomist and you also got your certification and an EMT license. So
Mhm.
I've noticed that a lot of pre-meds they always start off something else or they start off as an EMT, but they're always going towards EMT for their clinical experience. Would you say EMT is being an EMT is like the best clinical experience? Like, did you start off as a phlebotomist, then you ended up turning into an EMT? Like, I mean,
Yeah, so the reason I ended up getting both was that a lot of emergency room technician jobs, which is what I was aiming towards, during my gap year. It ended up being during COVID, and I wasn't able to pursue a clinical opportunity,
Hmm.
and opted for the research one. Require you to have both an EMT and a phlebotomy license. So I had
Okay.
initially gotten the EMT license, and then I went to like an accelerated phlebotomy program so that I basically have all my certifications in place when I would go apply for an emergency room technician job.
Mm.
So I think any way that you can have meaningful patient interactions, whether that's being a patient care aide, a medical assistant, an EMT, phlebotomist, the purpose is number one to confirm that medicine is something that you want to do, right? If you're in clinic settings, if you're in emergency room settings, taking care of patients, and you don't feel that motivation, that desire to help others, then that might mean that medicine's not for you, and that's totally fine. But these are things that you can't theoretically uh, find out about, right? You have to see for yourself, and that looks different for every person.
Mm.
So I wouldn't say that one experience is better than the other. I would just say that the degree of hands-on care is, of course, going to be different, an EMT versus, a medical assistant, for example, because you're actually providing care in the field and, helping transport patients and stabilizing patients and whatnot. Um, so I would say whatever avenue that is before you that you can pursue and get uh, direct patient care and contact is favorable. And I think most importantly is what you take away from these interactions, right? So during your med school interviews, during your personal statement, being able to remember moments that stick out to you and why they stick out to you, why you felt a certain way or you feel a certain drive towards a patient population or towards medicine in general, I think is even more important than the experience itself.
Got it. Yep. So now let's talk about why you ended up deciding to apply to urology. How did that come about?
Yeah, so I think choosing a specialty is especially difficult in medical school. And the reason is that you don't get exposure to every single subspecialty. And I'm a firm believer that the exposure that you do get to certain specialties can be highly influenced by who you happen to work with, what kinds of procedures you see. Um, and a lot of that is frankly out of your control. So, I mentioned I initially wanted to do neurosurgery. And you get different opinions from those who are senior from you or to you. So, this is not a knock on neurosurgery at all, but I heard that from an attending when I was a pre-med that what, maybe think twice about neurosurgery. Patients are very sick when you're doing a lot of these operations. There's a lot of trauma involved, and perhaps consider different specialties. And then I had a mentor who was an orthopedics resident, and he was kind of telling me about patients do great. You can do hip replacement, joint replacement. You work with all these tools. And I felt that that was something that interested me. And from the beginning of medical school, I was actually leaning toward orthopedics the entire time, doing research. All my mentors were in orthopedics. And it wasn't, like I said, it wasn't until I had proper exposure to orthopedics that I realized that this was not what I thought it was from the outside looking in. I personally found that, the surgeries I weren't particularly drawn to. I didn't enjoy the bread and butter cases of orthopedic trauma, fixing a bone, doing a joint replacement, and you have to listen to that little voice inside your head when you're in there standing in, which is going to be you in a couple of years, right? You're standing there in the OR. You're not doing a lot as a medical student. You're oftentimes retracting or holding traction, cutting suture. But if you're just dreading every moment, if you can't wait to go home, if you get home and you have no desire to look at the cases for the next day, listen to that because your life is going to be that during this potential surgical residency or during your career. So don't ignore the natural interest that comes from within. And where urology stood out is that I shared a rotation with a urology intern when I was a third year student, and he had convinced me to do the elective primarily because of robotic surgery. I was always fascinated with robotic surgery, and I never really knew how it was done or what the indications were. And from the first day within my urology elective, it was just night and day as compared to orthopedics. I think the residents were so friendly, so willing to show me the steps of the procedures, to explain things to me, and that little voice, that inner drive to want to look up, why is robotic surgery done? What are the types of surgeries that you can do with a robot? What are the other modalities of surgeries within the field of urology? What does a lifestyle look like? I think all of that was just attractive to me as a medical student thinking about something surgical, and I made a definitive decision to switch in that moment, and part of that included knowing that urology is a small field and that everyone really knows one another, and led me to actually take a research year at Fox Chase Cancer Center in Urologic Oncology, fully dedicated towards urology research. And that's kind of where I completely solidified my intention to pursue urology within the research, within being in these, clinic settings where patients are dealing with a lot of challenging issues, and being able to be that trusted voice to help those patients through those tough times is really what drew me to the field, and I'm so glad to have made that decision.
Great. Yeah. Okay, so let's take a step back and let's say we were in a world where medicine didn't exist. What career path would you have chosen instead?
I think that's a great question. I think if medicine didn't exist, I would really aim to be a restaurateur. And I think part of that is because of the multifaceted aspect of you're not only running a business, but you're creating the experience for your customers. And, that experience is tangible, right? I think like designing a restaurant and a menu and really curating a moment for your customers, I think is something that's so special. And, I think that there are some similarities I can sense between like the culinary world and the medicine world. A lot of these chefs kind of train under certain, renowned chefs and learn different techniques and move from restaurant to restaurant. Similarly to kind of in the medical field, you hear about, well, someone did their training here and this is like their specialty. That I think that would keep things interesting to kind of have that ability to provide experiences for your customers, and kind of make those memories and facilitate those memories, because oftentimes like people are going to a nice restaurant, a nice dinner for a celebration, a big moment in their lives, right? A graduation, a birthday. And I think being able to give that experience to people would be really rewarding.
Great, yeah. Okay. All right. Oh yeah. So you mentioned pivoting from wanting to become a neurosurgeon before medical school and as a pre-med. And then when you were in medical school, you said you wanted to be a orthopedic surgeon, right? And then you ended up pivoting to urology, and then you just go research here and everything like that. But how was it with your mentors that were, like you said, you had a lot of mentors in orthopedic surgery. So how was it when you pivoted? Did you meet other mentors in urology, or how was that
Yeah,
conversation? Yeah.
yeah, I think that's a great question, because you're always going to have some uncertainty about, is this the right decision for me? I'm dedicating a research year. Am I going to like it? But I think what goes to, this speaks to what I said before about that inner desire, that intrinsic motivation to look into the field in a serious way. And I don't think I had that for orthopedics, even though I was doing research and kind of going through the motions of what you should do if you're interested in orthopedics. I genuinely, if I had to interrogate myself, I wasn't drawn to the field as much as the people that I knew that ended up matching into orthopedics. And I think that goes along with the mentors. I had serious conversations with them, and of course, everyone is supportive of your path as a medical student. They know that you're still exploring,
Yeah.
and even within residency, people switch out of residencies all the time for various reasons. So I think there was nothing but support. But at the same time, I think for me to be confident in my decision, that I had to have a plan in place for pursuing urology. And with that came, having a whole support system and network. And, fortunately, the residents at Temple were excellent in helping me get to where I needed to be, in terms of securing the research position and finding different positions, and in supporting my journey since then. So I'm incredibly grateful to those residents, to the faculty who served as my mentors and really facilitated me being successful in matching into urology, which historically is kind of less advertised and has its own application process, and it's an early match. So there's a lot of nuances that you kind of have to be caught up to speed with if you decide to switch over.
And how would you say networking helped shape your journey from the very, very beginning?
That's a great question. I think that networking is so underutilized, especially within the life sciences. And I think to my friends who are in finance and in business, my brothers in law, I
Mhm.
think that intrinsically humanities majors and those departments facilitate networking better. I'm not quite sure why, because the sciences should equally value networking, but a lot of the decisions that I've made throughout my training were based off connections and networking, but targeted networking. And I think networking is a very loose term. So what I mean by that is you're going to have mentors and a network at various stages within your path in medicine, right? So what that looked like was as a pre-med, looking towards those upperclassmen within clubs that I was in, within professional societies I was in, who had already successfully applied to medical school, right? I think the path has already been carved by those before you, and gleaning from their experience to apply to your experience is the best way for success. I think there is a time and place for carving your own path, but the general formula and game plan should be something that is replicated, especially if someone's coming from the same background, from the same undergraduate institution. There's no reason to try to carve your own way, your own path to medical school when you know that certain things work for certain people and that you can apply that advice to your path in your career. So, as a pre-med, that meant connecting with upperclassmen who had successfully applied to medical school. As a medical student, that meant with connecting with medical students, third and fourth years who were interested in orthopedics or interested in urology, and then finding residents and faculty members who could give targeted guidance for your path within medicine. And you'd be surprised to find that, or maybe not surprised, all residents and faculty want to do is to help you achieve your goals because they were in your shoes once and they made it throughout the process. And I think if you're in academic medicine, you are more inclined to help medical students. That's part of the impetus for being in academic medicine is that you're willing to teach and willing to mentor students. So I think, you talk about networking.
Yeah.
I think in developing these relationships, it's important to not come to the table empty handed, right? And what that means is every time you're going to meet with someone who has more experience than you, something that you hope to glean from them, right? So you talk about networking, and
Yeah.
I think one important point to bring up is whenever you meet with someone who's a few steps ahead of you, when you're a medical student, you're meeting with a resident or a faculty member. When you're a pre-med, you're meeting with a current medical student or an upperclassman. You always want to come to the table with something in hand. What I mean is be prepared, have targeted questions,
Okay.
ask specific questions. How did you study for the MCAT? How did you study for step one? What away rotations or how did you approach away rotations for residency, right? I think it's much easier to provide quality advice and mentorship and guidance when your mentee comes with specific questions that they want answered and that maybe they've already attempted to answer, but they want your input on. Rather than, some of these relationships might be more loose and you don't really get as much out of those conversations than if you were to come a little bit prepared to those meetings. So that's something that I've always tried to utilize within my research network, within my clinical network, even within LMSA, is to have an agenda, a mental agenda. And I know your mentors would appreciate that as well. Another thing too is the longitudinal aspect of these relationships. You know, checking in with your mentors as appropriate, not really, seeing them once and then, that's it. I'll see you in like a year or two, but
Yeah.
checking in with them, keeping them updated because that makes them invested in your success. And you never know that a moment when you reach out to them might be an opportune time that they might have an opportunity for you. So I think this all goes in part with having specific mentors for specific stages in your path within medicine, being prepared. And then I think my last piece of advice for networking is to always have an updated CV and resume at all points, because a lot of times you'll find that opportunities to apply for scholarships, opportunities for research, opportunities for summer programs. It might ask for an updated CV and resume. And if you're there dusting it off, it's been like a year since you've looked at it, you might not be as prepared to jump on those opportunities. So I think that opportunities come to those who are prepared. And I've certainly benefited from kind of being ready at a moment's notice to send over materials, things that are required for these applications, because you'll benefit the most from that by being prepared.
All right, so far you've said very, very positive things and a lot of your successes and accomplishments, right? So do you want to talk about failure or times you've dealt with a lot of stress?
Yeah, I think that, one moment that sticks out was when I had research opportunities in undergrad that ended up falling through. And it was something that I had relied on, that I thought was going to continue, and, abruptly, due to different circumstances, ended up not being the case. And, I was kind of faced with a decision of, now I kind of lost my research experience. I don't know quite what to do. And, in those moments, or in that moment, I happened to look for different opportunities that aligned with my interests, in terms of volunteering. So even though at the time it seemed like a loss, to my, I guess, like research experience, it ended up working out that I got tapped in with a lab that focused on veterans research, and I had done volunteering with veterans nonprofits during undergrad,
Okay.
and that lateral to an experience that translated to a gap year job during COVID. So that was something that was completely unexpected. I didn't think that it would turn to like a full-time gap year position, as a result of switching research initiatives to that lab. But I think what I learned from that experience was that, you know, not giving up on yourself, not giving up on your interests, and not allowing a setback to kind of define your experience is key to pivoting and finding what works for you. And oftentimes, that might be opportunities that you have to seek out, right? So this position wasn't particularly advertised, but I knew that I wanted to work with veterans within the clinical research setting, and it was a lot of cold emails. So that's something that I learned to develop through that experience, is just simply sending a professional email to a professor or a doctor, and being willing to hop on the phone and expressing your interest, and knowing, again, this goes back to what I was saying before, sending your updated resume, having everything completed, because you never know when opportunities are going to come up or when you might have to pivot out of different opportunities. Uh, and having it work out was a real benefit, even though at the time it seemed like, all my research initiatives were crumbled.
What's one piece of advice you would give to pre-med students? Very broad in general, but
I would tell pre-med students to focus on their true interests and pursue them fully. So what I mean by that is having two or three extracurriculars that you truly deeply care about, that you've been involved with for multiple years, that you see or enter the position and transform it in a way that is substantive, that outlasts your time in that position, is far more valuable than spreading yourself across 5 or 6 different extracurriculars. So I can think about, my volunteer position at my local hospital. It was a basic volunteer position. You're stocking supplies, you're giving blankets, but I knew that there was a lack of a formal mentorship program. So I came to the program leadership, and I came up with a way that we can connect the volunteers, because they're all doing shifts at different times. So a way that we can connect with one another, provide advice and guidance to those high school students who are part of the volunteer team entering college, to pre-meds, sharing experiences with one another, and that became a part of the program. So, whatever role you find yourself in, always thinking to yourself, how can I improve? How can I make this better? How can I tailor it to my goals within this position? Um, and having that sort of initiative, that internal drive, will only carry throughout your medical training. And so that's my advice to pre-medical students is really find your interests, your true interests, whether or not they align with medicine. And if they don't align with medicine, find a way that you can integrate medicine, right? So,
Yeah.
for example, I brought up the veterans nonprofits that I was volunteering with. I it came from a exposure to the veteran homeless population within Los Angeles at the time, right? And how can we help this patient population? And then slowly through the clinical side evolved to being involved in the mental health research and learning more about the VA and how healthcare is delivered and what services we're providing. So that kind of bridged the gap between, the volunteer work that I was doing and then the research work that I was doing. So you kind of have a cohesive theme about your interests on your application, and it covers multiple facets, right? The volunteering, the clinical, the research side. And I think that speaks to kind of your interests as a person and as an applicant, and will only serve to benefit you.
Great advice. Yeah. And what's one question you wish more pre-meds asked you about? Maybe a misconception in urology or misconception about medical school.
Yeah, I think I always love the question like why urology? Because, it's a little bit unconventional. It's not one of those fields that stick out to you, especially as a pre-med or even as a medical student. Like I did not know that I wanted to go into urology as a first year medical student. So being kind of curious about different fields, and then you know, exactly what you're doing. I think asking how do you network? What's your approach to networking? How do you get the most out of relationships with your mentors? How do I find a mentor? I think those are great questions because it gets more at like this process that we're practicing as medical professionals that will continue throughout your career. And, I'm speaking from a place where I haven't even started residency yet. I'm not even a doctor yet. I get my MD in a couple of months. But I think being able to kind of pass some of that insight along to the next generation so that you can improve and be better and take that advice. Again, like I said before, people have gone the path before you. Take what you can from those people, apply it to your situation and improve, make it better, and then pass it along. I think that's the final step, is to pass that knowledge along because, you know, bringing those who are coming after you with you, I think is just as important as you paving your way to success within your medical career.
And what is one quote or piece of wisdom you live by?
I think that's a really great question. I think something that is universally applied is just simply never give up. Never give up. Believe in your abilities, have confidence in your abilities. If you've made it this far, you know that you can make it all the way. And it's a big commitment, but if this is something that you truly want to give back to patients, to care for patients medically, surgically, then this is not something that you take lightly. And if you have the commitment and the drive, and this is truly, truly what you want out of your career and out of your life, then it's not worth giving up on. And of course, you're going to have the work ethic, you're going to have the resources and the knowledge behind you. But at every stage, I'm just starting out, right? But you have every single college exam, every single final exam, the MCAT, step one, step two, your board exams, step three. So there's going to be barriers along the way, academic barriers, quotas, benchmarks that you have to hit. But if this is truly the drive within you to excel and succeed and become a physician for the benefit of your patients, then you're not going to give up. You're going to wake up, whenever the alarm goes off, 4:30 during your rotations. You're going to come home late and you're going to know that you're building towards becoming the physician that your patients expect of you and that you can give back to your communities and to your patients in the future.
Great. So if somebody were listening to this and they didn't hear a single thing that you said, how do you want them to remember Michael Lesgart?
I would want them to remember me as someone who was dedicated to their family, their faith in God, and their commitment to becoming an excellent urologic surgeon for all patients.
This is AP Med. My name is Andrew Poveda, and we just finished interviewing Michael Lesgart.